Sherman is the Director of Breast Services for Northern Light Health. Thank you so much for coming in. Now, I see that you're wearing pink, and perhaps fittingly so. October is Breast Cancer Awareness Month. Talk to me a little bit about why it's so important to discuss breast health.
So, as you may know, 1 in 8 women is actually diagnosed with breast cancer in their lifetime in the United States. So, breast cancer, the sooner we detect breast cancer, the easier it is for us to treat. The more treatment options that are available to you as a patient, that's really why it's most important.
Yeah, why is early detection so important?
It prevents the spread. The earlier we find it, we prevent it from getting spread to other areas of your body, which then would limit your treatment options.
Symptoms to keep in mind that may indicate there's breast cancer?
Lots of symptoms. So women particularly are aware of their changing breast tissue throughout their lifespan. So the more self-breast exams that you do, the more awareness you have of changes to the skin itself, so redness, tissue thickness, things like that. The nipple inversion is actually a big symptom of breast cancer that patients don't always know about. Discharge as well from the nipple. But the biggest change, and probably the one that we talk about the most, lumps. Any new kind of mass or lump in your tissue. So that's why it's so important to get not only your mammogram, but do your self-breast exams and get a clinical breast exam every year.
Can breast cancer be prevented?
Well, most cancers, prevention starts with living a healthy lifestyle. So we want you to limit your alcohol intake, eat a healthy diet, get your exercise, 30 minutes of exercise every day, stop smoking. If you are a smoker, don't start smoking if you aren't. Those things that we do every day to live a healthy lifestyle.
And what about mammograms? How important are they?
Mammograms are our biggest and best tool to help with the detection of breast cancer. So we want you to start getting your mammogram at 40 for most women, but if you have a family history or any kind of increased risk for breast cancer, we really want you to start getting it earlier than that. So we want you to call your primary care and have that discussion with them, because there's a lot of other tools in our toolbox that we can use to help with the detection of breast cancer.
What about women with breast implants? Can they have mammograms?
As a matter of fact, they can, and it's so important. I think a lot of times women with implants feel they're scared of rupturing an implant because of the pressure that we use with mammography, but mammogram is still the best method of detecting breast cancer, and more so even than ultrasound. So we want you to get your mammogram if you have implants. They are safe.
So we just went over a broad range of things, and if people want to know more, where should we send them? What's a good resource for more information? So
the best resource is probably your primary care provider. We want you to have those conversations early and often, and then we have our Northern Light Health website, which we have a women's health page dedicated to this information.
Yeah, you see it there on the bottom of your screen, northernlighthealth.org/women's health. Thank you so much for coming and talking to us about this subject.
Thank you so much.